Inner Voice, a heartfelt chat with Dr. Foojan.
I like it very much, and it says we are memory, which is very true, because memory forms who we are and who we can be potentially. And it all relates to how the neurons and those billions of neurons and the interaction between those neurons through the connections, we call them synapses, how those synapses will get informed, and they are, making some networks of networks. And within those networks, chemicals actually play a role, but the common language of the communication between the neurons within the synaptic space is electricity.
Introducing a powerful new update from the Foojan app. Now with flexible subscription plans to fit your journey monthly, quarterly, or yearly. Our new AI-driven onboarding customizes your path to feeling better, faster, and enjoy a refreshed experience with stunning 3D interactive videos. Update now. Empower your inner voice with Foojan. Download today.
Welcome to the Inner Voice, a Heartfelt Chat podcast. I'm your host, Dr. Foojan Zain. I'm a psychotherapist and author and the founder of the International Awareness Integration Institute. Today, I will be talking with Dr. Mohammed Nami. He's a clinical cognitive neuroscientist focused on improving how we identify, predict, and treat neurocognitive and sleep-related difficulties. He combines modern brain and sleep assessments with behavioral evaluations to better understand the roots of cognitive and emotional challenges. His work aims to support earlier detection and more effective long-term care for patients. Dr. Nami serves as an associate professor of neuroscience and clinical neuropsychology at Canadian University of Dubai, and as a clinical neuroscience director at Brain Hub in UAE in Dubai. It's been a pleasure talking to Dr. Nami. I learned a lot from him. This conversation goes from how do we handle our memory, how do we change our past memories, the ones we don't like, and the effects of it on the trauma and post-traumatic stress disorder. And then we land on dementia and aging related concepts, which many of us are very concerned about. So he's 12 hours away from me. So it was very much, I appreciated that he had the ability to be with us. And I'm sure that you'll learn as much as I do and you enjoy our conversation as much as I did. Now be sure to subscribe to this podcast, my YouTube channel, and connect with me at foojanzain.com. Go to the app and learn about awareness integration and enjoy working with your, in every area of your life and really looking at, enhancing your life and creating a fulfilling life for yourself. Connect with me on all my social media platforms. I love to hear from you. So share your thoughts with me. Without further ado, here's Dr. Mohammed Nami.
Listen up if you want to promote your personal growth and self-awareness. I found the Foojan app last month and I have been absolutely loving it. I personally have never learned guided meditation, but thanks to this app, I now have learned incredible tools for my own stress relief and emotional self-awareness. Not to mention, there are self-evaluation tools and professional coaching available to utilize however your journey to self-discovery takes you. Join Foojan today and redefine your life one step at a time.
Intentional Parenting, a practical guide to awareness integration theory, written by Dr. Jafari, Dr. Foojan Zain, and Dr. Manoukian, 3 experts in human development, is your step-by-step guide to raising a healthy child prepared for a culturally integrated world. You're supported in parenting infants to adolescents using the latest evidence-based scientific research on parenting. Order your copy on Amazon now.
It is such a joy to have you, Dr. Nami, all the way from Dubai. Thank you so much for accepting my invitation.
Thank you for having me, Dr. Foojan. It's always an absolute pleasure to be on your show, and I really appreciate the time, passion, and the enthusiasm you put into the work. You're on top of it, and I mean, discussing science for a reason is always a joy, an absolute joy.
Yes.
Yeah.
For all of our audience to know that last year, I've known Dr. Nami for many, many years, and we've done a lot of different research. But last year, I had the privilege of going to Dubai and in his clinic, and we did a research where he conducted all of the research with QEEG and body monitors, and then we did the awareness integration therapy as we like we did the pre-test, during test, and the post-test, and that paper will be published soon for everybody to have. So it was the first time I actually met you face to face, and then our continuous work together. Dr. Nami, I know that your expertise, not only as a neurologist, but also with sleep disorders and memory, and many recent research has come up in how memories are formed, and how we can possibly have an influence in shifting someone's memory from, obviously the negative memories, the PTSD that they have to live with, all of the constructs that shows up not only in their sleep, but also as flashbacks all day during the day. So just to open, if you could share with us a little bit about the construction of memory, and then we could take it step by step.
Yeah, sure. There is one clear statement that I like it very much, and it says, we are memory, which is very true, because memory forms who we are and who we can be potentially. And it all relates to how the neurons and those billions of neurons and the interaction between those neurons through the connections, we call them synapses, how those synapses will get informed, and they are, making some networks of networks. And within those networks, chemicals actually play a role, but the common language of the communication between the neurons within the synaptic space is electricity. Within the course of the neuron is electricity. So it's like an electrochemical dynamic across all the neural structures that you're putting together how the brain functions. But memories are formed in shape of, when synapses are getting in shape, and the synapses will remain there. When they're sticking in place, there is a process, what we call it long-term potentiation, or LTP. LTP is the physiological basic principle through which memories are formed. So memories are synapses. If I don't know that person, and I got to know the person's name and the job and the position, so three building blocks of inputs has been registered in my brain, better say in my neural structures, and those microenvironment across the neurons, we have synapses. Those synapses are actually the basic elements of memory formation. Okay, so that is, like, in a nutshell and very short, how memory is getting formed. Memory is anatomically defined as per the form, stability, connections between those neural projections, number one. Number two, how strong those synapses or how strong those connections are. And number three is that how the chemical and electrical interplay across all those neural structures helps us retain, recall, recollect, restore, consolidate, and reconsolidate memory structures.
Based on some of the work that we've done with the awareness integration, which I also got a lot from, eye movement desensitization reprocessing, which has a information processing theory behind it. It also seems to add to what you were sharing, that the way that it's also held is by a thought process, an emotional process, and kind of engagement of the sensation in the location of the body. And somehow those are stored, and would the recall help as part of the awareness integration, part of the way we go and recall the origination of some of the memories where we hold these belief systems, is as if the lock is through these three: the belief system, the emotional impact, the feeling that shows up, and the sensation in the body. Can you share a little bit, or open that up a bit for us?
Yeah, definitely. What happens in the process of EMDR, which has been a time-tested, quite fundamental approach to the behavioral reorganization and also like cognitive grounding in a way that the person will be able to kind of remodel this attentional emotional bias towards certain stacks of memory. This is very physiologically definable. What happens is that, let's back up a little bit. In the memory process and how the memory forms and functions, we got different stages. We have encoding, registration. The next step will be consolidation, and then we have reconsolidation. Then we have retention, and then we have the recall or retrieval. So there are different stages that they go in dominoes, and memory formation could be established when all those different processes or different stages are accomplished and completed. Otherwise, we would not be able to recall that memory, or it would not be easy for us to recall that memory, right on the spot. What happens is that memory is just widespread across the brain, and all those networks, all those micro neuronal structures that they are forming synapses. They are in all different cortical and subcortical structures in the brain. But the gateway for the memory is the hippocampus right here. And then we have like the entry of the hippocampus, which is called entorhinal cortex. Then we have the hippocampus itself. This is like the main buffer for the memory early processing. Then the short-term memory or the working memory, which is actually getting processed in the hippocampus, transfers and reverberates all those information to the very surface of the brain, which is the cortex. Okay. And we have in this areas of the brain here, we have a cortical areas just at the surface of the brain, what we call it FEF, which is frontal eye field. So we have the right frontal eye field and left frontal eye field. When I look left, actually my right frontal eye field is getting involved, and then I will be able to have this conjugate eye movement. My right eye goes to the left, my left eye goes the same direction, so I'll be able to look left. And to look right, the opposite mechanism gets involved. This is actually intentional. So you can intentionally decide to look right, to look left. But what happens during sleep, for example, is not really intentional. We got this turned through, rapid eye movement, which we do not have any conscious control over it, correct? But what if during the wakeful hours, I kind of try to voluntarily look right, left, and just through that, I will kind of mimic and replicate what happens during REM or rapid eye movement sleep. Why is that important? Fact of the matter is that during a REM sleep, it has been very well documented through huge, compelling, body of evidence over the past several decades that in the REM sleep, we get consolidation and reconsolidation of the emotional memory. And what is anxiety, depression, and chronic anxiety disorders, PTSD? What is that all about? It's about negative emotions. And negative emotions become, unfortunately, or whatever, they become very salient, correct? Because the brain loves to pay attention to the negative stuff. All the time, the newspapers with bad news will sell more than newspaper with good news. And that is an evolutionary thing. So we are emotionally, attentionally biased toward the bad things. And if something happened to me, if I received a condemnation, criticism, or objection, or something didn't go well, I'm going to retain that memory and carry it over with me for longer period of time, rather than the time that I received a compliment, a good thing, So most of the time, we count our miseries, not our blessings. And, so yeah. So what happens is that in those cortical structures, those negative thoughts are actually getting consolidated, and they have turned into robust memory related structures, synapses, LTPs. Question is that as we're getting into write something using a pen or pencil, at the other end of the pencil, we got the eraser. Would it be possible that we use the eraser to wipe off that unwanted, like disturbing memory, or those distressing worries that when I recall them, they give me whole outbursts of the negative emotions, outbursts of anxiety-related symptoms turning into panic-like episodes, can I get rid of that? Can I make those, negatively emotionally loaded memories more distant, not at my fingertip? The problem with the PTSD is that those negative emotions are at the fingertip of the individual. So the moment that they do the mind wandering, they start recollecting those negative thoughts, correct? And these areas of the brain are actually, across the cortex, those networks are actually getting reignited because they are buzzing and transducing information from this network to another network, building upon those memory constructs, and they are causing the recall or retrieval of memory. And that is something which can happen to me. Okay, I and you or everyone, we might recall something not pleasant for the past. It might be a removed past event. And I go, all right, that is life. And we let it go. But what if those negatively, emotionally loaded memories become very robust, very prominent, and quite frequent incidents? And it happens on and on. And every single hour, I keep reverberating those memories, recalling those memories, not in a very usual way, in a very vivid way. Okay, this means that the memory is being recalled in as much as possible details, and it's quite clear. All the sensory inputs, as you indicated, they are being reviewed, like sight, the smell, the taste, and also all the words or the statements. I'm going to reverberate and recall all those things. Is there any way to change this long-term potentiation to long-term depression? In other words, can I use the other end of the pencil, using the eraser, to make those robust memories less paramount? Potentially, yes. Theoretically, yes. And that has been a big question which has been delved into for the past several decades through psychology, neuropsychology, and recently advanced neuroscience. And now we know that it is possible. One very fundamental and grounded approach for this is EMDR, which we can talk about that even more.
Absolutely. I think what the part of the new research that it was showing was also that the episodic memory, sometimes we have this expectation as if we go back into a memory, it is a solid story with a beginning, with a middle, with the end. And part of what this research was saying is that, yes, there is some of the information that was held at the time of an event, but every time that we go back and revisit that memory, we're actually taking information from who we are today, what information we have today, what our surrounding is, and we kind of like enter and integrate more information of building that story. So part of the good news is, obviously, if we're in a better place, if we are in therapy, if we are working through any of these, that we can take some other positive aspects and integrate it into the memory. And I think part of what we've worked on in the awareness integration phase 4 is when we go to the memory, not only we look at the let's say powerlessness, the hopelessness, all of the angles that we were at that time, kind of caught into the frozen moment of powerlessness, that we start looking at entering and bringing new information and accessing that in memory and integrating it with new information, which is positive. And that also changes the narrative of it. So what EMDR has done, because I've been trained in EMDR for almost 20 years, and I think it's a magical, really a technique. So with the EMDR, there's a physiological perspective of the eye movement, or, the sound from the right brain, left brain, or even kinesthetic of tapping from right brain, left brain. But also what happens in EMDR is we also introduce the positive belief system. So it does release the negative and the physiological tension that is in there, but also introduces the positivity. And then with the awareness integration theory, what we do is change the narrative and also focus at that moment into all the strength and resiliency. So we're bringing information into the memory. Can you share a little bit, kind of like unpack from your perspective, this concept?
Well, absolutely. And thank you for bringing that up. Well, when it comes to eye movement desensitization and reprocessing, as you indicated, almost the entire subsystems of physiology are getting involved, whether it is like a behavior of eye movement, whether it's cognition, okay, reviewing, reconsolidating memories, or trying to retrieve certain memories, either positive or negative memories. And at the same time, the sensory thing, okay, looking right and looking left means seeing something on the right hemifield and on the left hemifield. And motor and sensory function actually gets involved. So cognition, emotion, behavior, motor, and sensory, all the different 5 pillars of the nervous system structure and functions, they'll get involved. What happens is that there is physiological part which explains why this is actually remodel the way that we can have access or less access to certain type of memories. What we typically do is that, okay, on the right hemifield, there are triggers that the person, for example, recalls those positive motives, the blessings, okay, the cultivation of hope, and something that a person would celebrate and cherish every single day. So these are actually being instructed by a certified psychologist during the EMDR session. When the person looks through the right hemifield, all the positive motives will get reviewed. And that is actually like over time, session by session, it becomes like a process of operant conditioning. Okay, so over time, my brain gets used to this fact that, all right, whatever is on the right side is reminding me about the good things, about reminding me about all the hopes, all the blessings, and everything that I got. On the other hand, the left hemisphere, the left hemifield, will be about all those motives that they are putting me into the very intense sense of fear, distressing worry, XYZ. When the person gets instructions from a psychologist, looks at the left side, the same time we can give like a sensory disturbing trigger, like stimulus, which is like, could be like a very tiny little electrical shock to the index finger or to the middle finger. So the person feels emotionally recollection of those bad memories together with the physical pain and discomfort, which is a little bit of shock to the left hand. And then when that touches the left hemifield, done, then getting back to the right hemifield, the shock is relieved, everything is relieved. And that would be such a kind of like being back on track. The person feels on the right gaze, the person feels, all right, now I got a time to refocus, fixate on the positive thing. And that goes on and on. So after like 3, 4, 5 sessions, we're removing the shock. And we're replacing those negative thoughts with either neutral or positive things. So, and these needs to be carried forward through the surveillance and also constant instructions being provided by certified psychologists. So what happens is that, well, my brain learns that through this operant conditioning thing, all right, first I desensitized and then I reprocessed the left hemifield towards negative thoughts, started to replace them with the positive thoughts, or positive emotional thoughts or emotional memory. What happens is that the frontal eye field, FEF, gets actively involved in that. And interestingly, what we can do is that, as per more advanced and recent research works, we can integrate neuromodulation or like neuroscience informed personalized neuromodulation techniques to zap certain areas of the brain and to kind of remodel those networks' integrity. For example, one of the key things that the PTSD individuals are actually challenged with is about lack of proper cognitive emotion regulation. I don't want to recall it, but I recall it. I don't want to fixate on it, but always fixate on it. It's out of my control when I show that outburst of the emotional, or anxiety-related symptoms. So the cognitive emotion dysregulation is there. What if I stimulate and kind of, re-entrain those network structures and cortical hubs at the surface of the head in a way that I get to the stage of neuromodulatory changes, Yes, and that can happen. This can happen together with the RTMS, repetitive transcranial magnetic stimulation. This can happen together with the vagal nerve stimulation. So the person can receive like multi-modality neuromodulation, cortical neural stimulation, etc. At the same time, during the same session, the same arena, the psychologist is doing the thing on the forefront, and the neuroscientists are running the game at the backstage. So they go hand in hand. And that's the beauty of the interdisciplinary work. And at the same time, the person needs to be on top of his performance with regards to the healthy lifestyle, like diet, hydration, sleep hygiene, and everything. And if there is like ongoing symptoms of anxiety or depression at the same time, or any personality issues, or any kind of, neuropsychiatric challenges, whether for which the patient needs to take certain type of psychiatric medications, our psychiatrist colleagues will come on board, and they're prescribing those hardcore medications at some level. So these are actually going to close the loop, and the person will receive benefits from psychology, from neuromodulation experts, neuroscientists, from neurologists, from psychiatrists. So everyone around the table will help that brain to get to the best state of harmonious interaction between those areas that they eventually put together cognitive emotion regulation. And after like number of sessions, depending on the case scenario, person comes back to us saying that, well, I still can remember those things, but to a lesser extent. Number one, I happen to recall those memories, but not that frequently as before. And most robust and interesting thing is that the person says, even when I recall those memories, it doesn't cause outbursts of anxiety-related features or symptoms. I don't go like panic. So I have control. And that exactly ties back very beautifully with the awareness thing. So when the person is consciously aware of, I am fully here now, and I can control what I can control, right? So that for the AIT and the things that you've been mastering for years and years, we help the psychological underpinning of how neural structures get formed and remodeled over time. So through the behavioral inputs, where behavior and cognition are two very important pillars of how the brain functions and how our mind or emotions and thoughts are actually getting processed. But this needs to be partly managed by the individual, him or herself. So what you do and your colleagues, their AIT realm, have actually been involved with for the past several years is that you are helping the person and the individual to get the maximum insight to who I am, where we are, what we can do, and more importantly, what we cannot do. Okay, and what is under my control, what is not under my control, and what is the problem, what has caused the problem, what are the solutions, and what is the best solution. So those like stacking the thoughts in a way that we go for the best solution, and we be on top of the game to control and manage those negative thought motives will be the beauty of awareness integration approach. Correct?
Yes, we really wanted to bring agency, responsibility, accountability due to that awareness. And then that just brings agency. Like you do feel there were so many years that, when I was conducting, whether hypnosis or EMDR, patients and clients were feeling better, but they weren't owning it. So they would come back and say, do the thing you do. You did that magical thing and do the thing you do. So it was more like, okay, yes, as a therapist, I could do the thing I do, or, the technique that works for them. But it was, to me, it was also important for them to not just rely on me and to have the techniques in how for them, to be able to do that on their own. Obviously not very complex traumas, but, that's what our job is, to be able to support them. But on a normal negative constructs that happens all day, that they do have the techniques for themselves to be able to take care of themselves. There's like two more questions that I have still hanging on to the PTSD realm before we go into dementia, because I know that's also, so many people are interested in the concept of, losing their memory and, whether it's their aging or it actually turns into the diagnosis of dementia or Alzheimer's. But before we go there, still sticking into PTSD, there's obviously, Dr. Vanderkolk, Dr. Levine, there's so many amazing groups that also work with the somatic aspect of, the trauma is also in your body. It's not just in your brain. Don't only look at it. It's in every, it gets stored in your muscles. It gets stored in the cells of your body. There was one research that came up that said even the cells of your liver has its own memory,
Absolutely.
Right. So can you share a little bit about how memory is also in every part of your body, and not, you shared about where it is in the brain, but can you share also about that?
So again, the neural transmission happens across the synaptic spaces through the chemicals. We call them neurotransmitters. Those neurotransmitters are polypeptides. Those polypeptides needs to get produced. And the process of synthesis of the polypeptides depend on the expression of the genes, correct? And the genes, again, they have different layers of mechanisms that they either suppress or express the genes. That's from one side. So genes are the key players and the chemical things within each and every neuron at the cell body. And not only at the cell, at the neurons and each and every single cells across the body, the genes will play a part. That's from one perspective. Number two is that there should be a very good harmony between the central nervous system and autonomic nervous system. When this harmony is not there, the body keeps misinforming the brain through the overdrive of the sympathetic nervous system inputs. So the brain will actually get overtly under chronic microinflammation. And that hampers or hinders the function of those networks in an optimized way. So we have suboptimal integrity of those networks, whether it comes to cognition or emotion processing, whatever. So one of the culprits might be the misinformation and the lack of balance or harmony, integrity between the CNS and ANS. And in the ANS, or autonomic nervous system, as we all know, we have two major changes, the cold system and the hot system. The cold and hot system are actually translated in physiological term into parasympathetic nervous system for the cold and sympathetic nervous system for the hot, the blue and red system. These got to be in balance. And when the balance is lacking, then there would be lack of homeostasis in terms of the neural inputs to the different structures in the body, because those two chains travel all across the body. They innervate the heart, they innervate the lungs, the gut system, digestive system, the muscles, as you said, also the immune system, the endocrine system. Every single subsystem in the body actually got to receive something from the autonomic nervous system. And when the disintegrity of the ANS misinforms the cells, then there would be lack of proper homeostasis. And then the homeostasis, neuroplasticity will get reversed. So we do not have the adaptive neuroplasticity, but we'll have maladaptive neuroplasticity. Why do people with stress develop gastric ulcer, right? Why do people with stress develop tense muscles? Why, when I'm stressed out, I start palpitating? Why do I have buzzing in the ears? Why do I have that much of dry mouth? Why do I have, non-specific, weird, somatic, pain-related symptoms? Okay, well, how is that all explained? There is only one system, and it's called nervous system. But the nervous system has different subsystems. We have autonomic nervous system, central nervous system, peripheral nervous system as a part of, ANS is a part of peripheral nervous system, of course. But when the harmony, when the integrity, when the balance is not there, we got to be trying our most applicable efforts to put that balance back on track through the time, breathing, meditation, mindfulness-based exercises, yoga, and whatever, sensory stimulation, whatever is going to serve the cause for that person and is embraced by the person, is evidence-based, and is being backed up and endorsed by the healthcare provider, fine. What is good is right, and what is right is good. So when the person follows those instructions, over time feels that, okay, instead of maladaptive plasticity, I'm getting back on adaptive plasticity. The adaptive neuroplasticity is called homeostatic neuroplasticity. And that means that we're fine-tuning the autonomic nervous system over time. So the person starts to feel that, well, the proper inputs that are received from the autonomic nervous system now has been rebalancing, reorganizing my entire bodily organ systems, heart, lung, kidney, liver, muscles, everything. And I feel that I got this vigor. I don't have that tiredness, irritability, restlessness, lack of energy. Everything is getting in a better shape. So I'm back to life. I mean, this is the life I deserve the most. And that is very true. And when it comes to the cellular homeostatic processes, we have the genetic underpinning mechanisms that they are depending on, like clock genes. We have circadian rhythm dependent genes that they are only getting expressed during the night. That's why sleep is not a luxury. It's the most important thing to let those genes get expressed, those transmitters or chemicals or peptides be produced and synthesized and being used at the right time in a right context. So everything is like very intertwined, correct? But we have only one body, one brain, and one neural structure. So these things, this body and brain and neural structures is only one single system. And it needs to stay in balance. It needs to stay as like orchestrated, integrated way of interaction. When the discourse is there and it's optimal, then everything will be in a better shape.
One more question around PTSD, which is a buzz here, especially in the United States. I'm not sure if that buzz, I don't think that buzz is there in the UAE, but the concept of treatment of post-traumatic stress disorder with psychedelics and even MDMA, which is not necessarily considered psychedelic, but is mostly an upper. What are your thoughts about how this treatment of the post-traumatic stress disorder is being navigated, and how is something like MDMA or psilocybin could be potentially under the not just under your own visit of your own in your own home, but actually in a setting that is appropriate, in a medical setting that could be, ketamine has been used for the depression, but really, I think there's a lot more at stake at this point, where they're doing a lot of research on ibogaine with memory and addiction, of retraining the brain. They're doing a lot more work with MDMA for post-traumatic stress disorder, especially with veterans, and psilocybin with depression and anxiety and PTSD. Any comments on that?
Yeah. Very, very salient and important topic. And it is not anecdotal. Actually, it's been fundamentally and systematically researched, and we have convincing, lines of evidences backing up the idea of using psychedelics and remediating the cognitive, structures and like emotional biases. Yeah, we do have that. When we have, like anxiety, depression, PTSD, OCD, phobias, and type of personality disorders that they are, comorbid with these conditions. It has been documented that the use of psychedelics or type of medications that they are not necessarily being designed to be used in psychiatry, but they are being used for a purpose of these kinds, and they have been game changer. Ketamine, psilocybin, as you said, they are there, or even DMT has also been experienced in some clinical setting and research-backed ideas. The reason is that because they work on different types of neural transmission systems, chemical systems. They work on the glutamate system, they work on the cholinergic system, and they work on the kappa opioid system. And last but not least, they work on glutamate and serotonin. So glutamate, serotonin, cholinergic system, and kappa opioid system. So they work on those four different subsystems of chemo neurotransmission. And we don't know exactly how they work, but we know that they are serving a cause in a way that is not fully understood. But they might not work that beautifully for every single individual. And we might get like the opposite. We might go completely awry, and this may lead us astray when it comes to the wrong context for the wrong patient at the wrong dose in the wrong setting. So they are not for everyone. Even we have like 5 different cases of different profiles or prototypes of depression, clusters of depression. Only 1 or 2 of them may effectively respond to this kind of treatment approaches, but they need to be decided in a multidisciplinary, interdisciplinary approach. And the dose, the type of the psychedelic, the setting, the duration of the treatment needs to be very, very well decided. Otherwise, we might get into like a vicious cycle of not only lack of response, but also complications of the condition. Coffee is not for everyone. Peanut is not for everyone. Psychedelics are not for everyone. So it doesn't mean that if we have a case of depression who's been refractory or tolerant to those medications like SSRI, SNRI, then we can right away go for ketamine. No, ketamine might not be a good option for that person. They might have implications in certain cases when they either get combined with neuromodulation, CBT, or any other behavioral approaches. And it should be a very well informed decision by a multidisciplinary panel of experts. But yes, your point is absolutely valid. And we got quite compelling body of evidence that in certain cases, the use of psychedelics for medicinal reasons and medical reasons, they're actually holding very good value to treat a certain number of cases.
Beautiful. Now let's go to dementia, because obviously the rate of dementia and Alzheimer's are rising. And there is a lot of questions around what happens to the memory as someone is just practically just aging. And there was a study that came out that we age in different, when 44, then 66, and then somehow the latest that I read was the brain can make still new neurons and neuroplasticity up to the age 80. So there is some level of just natural slowing down of these neuroplasticity. But then there's the difference between then having the diagnosis of dementia or Alzheimer's. If you could just very quickly, and I'm asking something you teach for, semester after semester. I'm like,
sure. So the fact of the matter is that the genetic is playing a very important part. And now we know that there are some certain genes, including, like lipoprotein E epsilon 4, or other genes that they actually increase the risk profile to succumb Alzheimer's or age-related memory loss in a pathologic way, up to 3 times more than average population. So genetic is there, but are we the victim of our genes? Is there any, if supposedly I carry those genes, would there be any way that I differ? Would there be any way that I defer the process of age-related memory loss? I wouldn't get into that rabbit hole of early onset dementia or memory loss as it's not expected to happen at that age. Yes, of course, healthy lifestyle, proper sleep, and physical activity is if I want to share one single most important recommendation to the people how they can steer clear from the higher risk of Alzheimer's or type of dementia, is stay physically active. That would definitely be there. And also steering clear from substances, because for some people, even less harmful substances might be detrimental to the brain. We cannot predict a complicated, automated, and complex critical organ like a brain. What happens if I go for that substance? We can never predict how detrimental and how disruptive that can be to the brain. So better to steer clear from that, not to gamble on the brain, because we have 2 eyes, we have 2 ears, we have 2 hands, but we only have 1 brain. I wouldn't gamble on my brain. I don't know about some people, but if there is no guarantee that substance or whatever it is, how it's going to deal with my brain, I will drop the idea. I will not go for it. Okay, because what if a disaster come into play? Okay, so yeah, many patients that I see that they have developed early onset symptoms of dementia of Alzheimer's type or mild cognitive impairment. Many of them, they report poor sleep. They are, loud snorers, patients with sleep apnea, with chronic hypoxia to the brain over years, and they have been ignoring this. Many of them have been following a very, very poor and unhealthy diet habits, junk food, fast food, snacks, and also they've been into too much sugar. Many of those cases, they have had underlying medical problems, including hypertension and diabetes, and they have not been taking a very good care of getting those conditions under control. Some of them have been reportedly over drinking alcohol, have been exposing themselves to tobacco or too much of heavy smoking over years, because there are evidence showing that nicotine in long term would be very detrimental to the memory function. So nicotine, short term, yes, it boosts the memory, but in medium long term, that will be the foe. It's not a friend to our brain. And alcohol is definitely there, and it will just destroy those network integrity of cortical, subcortical, reverberation of memory constructs. So the hippocampus is the most susceptible area, or the medial temporal lobe right here is the most susceptible area to the cellular death or neuronal death. And that's the process, we call it like a shrinkage of those areas, namely hippocampus. And this is what we call it hippocampal formation, but hippocampus itself. The height of the hippocampus becomes less and less and less. And over years, the person will feel that, all right, I'm not the person I used to be. And imagine like a man and wife. The wife is telling the gentleman, well, you have always been telling good stories about everything. You have been a very good father to our children. You have been doing a lot of things. You have been playing instruments. You have been very good and competent in 1, 2, 3 and everything. And you have been always supportive. You have been always telling good stories. You've been always giving me advice on whatever. Today, I've been trying to match your socks. I've missed you. You know what I mean? Because the person is no more the same person. If our brain, if our memory is not there, then we will not be the same exact person. And that is the reason at the prime of our discussion today, the statement which I shared with you, and I thought, and I just said that I believe that's very true, is that we are memory. If memory is blank, is gone, we will go away, right? So we need to take care of this through what? Physical exercise, diet, sleep hygiene, make sure if I have any underlying sleep problem, I need to take care of it. If I have any psychiatric, psychological problems, anxiety, depression, if I have any type of, insult that actually putting my brain at a higher risk for damage, including substance and nicotine and alcohol, I need to take care of it. And also learn how to manage my emotions, learn how to keep the best level of control over my emotional impulses, how to be on top of my cognitive emotion regulation. These are ABCs of the brain health, and that will bring me a better brain health index. So the higher my brain health index, or BHI, is, the higher your brain health index is, the lower the risk for developing cognitive impairments and questionable progressive dementia, dementia of Alzheimer's type, and ultimately Alzheimer's disease, the lower the risk will be. So we need to really bank on it, and we need to be aware and kind of cognizant that, okay, as of today, what measures can I take to predict and prevent any, like irreversible damage to my brain? Because I got to use these noodles for the next decades of my life, right? So what happens if I don't really take a very good care of it? If I don't take a good care of my brain, it's already gone, unfortunately. And it is not like we have a magic wand and someone comes to the clinic with Alzheimer's and says, all right, you know what? I've read in the news that there is one magic medicine for Alzheimer's. Yes, there is a magic medicine, so to speak, and there are a couple of them. They're very, very costly. But does that reverse Alzheimer's? No. If I have Alzheimer's, those top-notch medications just help the process slow down, not to get worse, period. They are not reversing the case scenario. They are like statins for the hyperlipidemia, okay? They're just keeping the disease under control, not to let it get worse. That's all. So if I step into Alzheimer's type of dementia, it's very complex, okay? So prevention is king here. I need to know how I can prevent and how I can predict. If something is contradictory to my brain health state and functionality and well-being, bingo, I need to take care of it. I need to put a stop on what is maladaptive to my brain.
Beautiful. I know that there's a website, brainhq.com, which I've been very impressed by the way they do the brain training. They've done a lot of their papers and research have come out in how they've really supported this training of the brain with people who were vets and came back from war with brain injuries from sports, and also have created a lot as a prevention method for dementia and Alzheimer's. So I highly recommend brainhq.com, and it's not that expensive. It's very minimal with what we can do.
So whatever gets the brain like busy and active is always advisable. And it's not only that platform, there are many other platforms, but what you stated, it's one of the valid platforms. And we have many other similar platforms. No matter what, but when I get my brain active, when I challenge my brain, if someone doesn't know how to work with the tablet or laptop or stuff of that kind, or is not a technology friend, they can use the board games, or they can get the brain challenged, like crossword puzzles, whatever possible. But the brain games are one thing. The other thing is physical activity, because we need to get the blood, oxygen, and nutrient delivered to those neurons, okay? So if I sit still and try to solve crossword puzzles and I stay stagnant and very still, nothing gonna change. So I really need to drink water. I really need to be active, make sure that I have a balanced and rich diet, make sure that sleep is very close to my heart. Oh my God. Sleep is very important. I need to really invest on my sleep. And whatever maladaptive habits, addictive habits, behaviors, I need to put a stop on it. And last but not least, emotion control, mastering stress management. These are the things that they are basic elements towards the road of longevity, brain health, cognitive fitness, and cognitive emotion, integrity and regulation over years and years of life.
Beautiful. Where can people find you?
Well, but before we get into that, you're always on top of what you're doing, but sometimes I need to add something. Correction. I'm not a neurologist, but I'm a clinical cognitive neuroscientist. I'm an MD for sure, but I did my PhD in cognitive neuroscience. I'm currently an associate professor at the Canadian University, Dubai. So apparently I'm based in Dubai, and I'm a clinical medical director of Brain Hub UAE, where we provide multifaceted interdisciplinary approaches from different realms and approaches and perspectives. Whatever serves the brain, we actually involve that.
Beautiful. Any websites?
brainhubuae.com. So if they want to know about the things that are being done there, or they would like to feel, our correspondents are feel interested to get into more of articles, readings about the brain health and anything related to that, please make sure that you just give a shot to it. I hope you like it.
Beautiful. Thank you so much for taking the time to be with us. I know it's close
Thank
to
you, Dr.
midnight.
Foojan.
It's close to midnight in your time.
I really appreciate it. I mean, the amount of ambition and enthusiasm you put into spreading the science and knowledge. I know the big names that you have been interviewing with, but I don't know how useful the things that I shared here was. But one thing that I'm very certain about is that I did it very genuinely, and I know that if we follow those steps, we can at least be able to subserve the brain fitness and cognitive agility as we can, right? So let's stick to those things. And I really appreciate providing me with the opportunity to be on your platform, and hope to see you again on this.
Absolutely. I always learn from you, and I hope that everyone who's been with us has always learns as much as I've learned from you. Thank you again for being with us. And for all of you who are out there, create an amazing life for yourself and everyone around you. And until next week, bye-bye.
Are you a psychotherapist looking to enhance your practice? The Awareness Integration Therapy developed by Dr. Foojan Zeine is a comprehensive guide to the principle and techniques of this powerful therapeutic approach. Join the growing community who have elevated their practice and expanded their skills by embracing awareness integration therapy and witnessing its life-changing impact. Order your copy on Amazon now.